Say hello. Happy, hope you're all enjoying your Martin Luther King Day, Junior Day. And I know this is a really important day for everyone, and I'm really happy that people are joining. And I know we're a little late, pero anyway, buenos días a todos. Quería darles las gracias a todos por participar. Disculpe que me tomé un poquito más de tiempo de lo normal. Lo que pasa es que algo, no sé qué cambiaron en los settings de Facebook, entonces no me podía no podía entrar, ¿verdad? Pero it's been a little bit over more than a month since we last connected, and I wanted to welcome back everyone to a new year of Conexiones. And so I want to start off with, as we honor Dr. Martin Luther King, with a quote from 1966 that says, "Of all the forms of inequality, injustice in health is the most shocking and inhumane." And I think that 55 years later, this quote is truer now more than ever. And it's evident as we see the disproportionate impact that it has had, specifically on COVID-19 in communities of color, particularly in District 1. And so, a todos ustedes, ha sido más de un mes que nos vimos por este espacio de conexiones. Y como pueden ver, hay aviones y no sé qué tanto está pasando aquí por mi casa, así que lo siento. Estoy muy contenta de darles la bienvenida y usar este espacio otra vez este año nuevo. Antes de empezar, quiero tomar una breve pausa para poder, pues, en honor al doctor Martin Luther King, que usó estas palabras que creo que son tan impactantes, son del año de 1966. Y decía, de todas las formas de desigualdad, la injusticia en la salud es la más impactante e inhumana. Y ahora que estamos a 55 años después de estas palabras, son más relevantes a medida que vemos los impactos desproporcionados de COVID-19 en las comunidades de color y específicamente en el distrito 1, ¿verdad? Así que, so now that I'm figuring out how to use this time, we usually have somebody join me on Conexiones, and we're going to continue to do that. I'm really excited that my next guest next week is going to be Council Member Andrea Cardenas. I talked to her this morning because I want to make sure that we continue to have our conversations, particularly because these are the communities that are much more hit than anyone else. And I keep looking down because I'm trying to make sure that if you have any questions, that I am able to answer them. And so I'm going to have Devana from my team be sending them. And so I'm excited to be here. Estoy emocionada que la semana que entra Andrea Cárdenas nos va a acompañar, que es la regidora de Chula Vista. Y hemos trabajado juntos mucho durante la campaña específicamente, ¿verdad? Pero ahora vamos a trabajar juntos para nuestros distritos, para nuestra comunidad, y estoy contenta de que va a participar. Así que muy emocionada del trabajo que vamos a hacer en los siguientes años juntas. Entonces quiero que venga. I'm excited to kick off this new year of Conexiones, and I do so with the same spirit of when we first started over 10 months ago, right? To build informed and engaged communities. When I was elected, I promised that I would hit the ground running, and we've done just that. It's been, I'm on week 3. Well, today's a holiday, but I'm on week 3 and working really hard with my team, and you'll get to know them. I think I'm gonna, we have one more staff member that's coming on board, actually 2 more staff members that are coming on board in February that we had to wait a little bit longer. But I'm excited for you all to meet them, and I'm probably going to have them join me in Conexiones sometime in February so that they can introduce themselves, and you'll see why they're all, just amazing justice warriors that are doing great things in the community. They all come from the community and have been doing great work, and so I'm excited for them to be a part of my team. Cuando yo me elegí la primera vez, ¿verdad? Yo me comprometí con los votantes que me iba a poner a trabajar inmediatamente. Entonces estoy emocionada que ahora que empezamos el año con Conexiones, lo hago con el mismo espíritu de cuando empezamos hace más de 10 meses, que realmente pues era para crear una oportunidad para tener a nuestras comunidades informadas y pues más que nunca comprometida a que la información sea para todas nuestras comunidades, ¿no? Well, so let me just tell you what's been happening in the last, 2 weeks at the Board of Supervisors. And like I said, feel free to ask questions. I'll be looking at the site to figure out who has any questions, and happy to answer any or suggestions or recommendations that you may have. All right. So, all right. So in the last 2 weeks, what's been happening? This past week, I was proud to introduce 2 resolutions together with Chair Fletcher. And the first one was directing the County of San Diego to take a more data-driven, collaborative, and equitable approach to addressing COVID-19. Las últimas semanas, la semana pasada, tuve el orgullo de presentar 2 resoluciones junto con el supervisor Fletcher. La primera resolución se enfocó específicamente en respuestas equitativas de colaboración y basada en datos científicos para abordar todo lo que sea COVID-19. Entonces, ¿qué significa eso? Eso significa que, por ejemplo, ahora que estamos viendo lo de las vacunas, ¿verdad? ¿En dónde específicamente vamos a tener esta información? En toda esa base de datos para específicamente enfocarnos en las comunidades que más lo necesiten. Entonces, ese sería un ejemplo de cómo hacerlo. And so when we're talking about equity, what does that look like in terms of policy and how we're going to be able to be able to do this work in the community? And so a good example of that is how we're looking at the distribution of the vaccines, right? We're looking at it from an equity lens, and it's very data-driven to make sure that, of course, we have guidelines from the CDC, and they, there's specific information that comes down, but we are able to decide, okay, this is the centers this is the communities. These are the communities that have been highly impacted, who don't have access to healthcare, and this is where we need to be focusing on. And so that's one example of how we do it, and in one department, Health and Human Services. But I think this is a broader perspective that helps everyone understand what that means. The second resolution was for us to have an opportunity to declare racism as a public healthcare crisis, and I think this one was of particular interest to me, and my team and I working with Chair Fletcher on this because of what that means and the work that I have been committed to, from day one that I started doing work in the community. And so, la otra resolución específicamente enfocándonos en cómo el racismo es una crisis de salud pública, ¿verdad? Y eso es importante, y como lo mencioné durante mi presentación en la Junta de Supervisores la semana pasada, era de que sí hay un impacto, hay una gran diferencia en cómo se le trata a una mujer afroamericana o negra en vez de a una persona que no es, ¿verdad? En los hospitales, en acceso a la medicina, médicos, etcétera. Entonces, ese es uno de los pocos ejemplos, pero yo estoy comprometida a seguir haciendo ese trabajo porque creo que es importante, especialmente en nuestras comunidades afroamericanas, que exista este tipo de resoluciones para elevar a las comunidades, ¿no? Entonces, one of the things in terms of the resolution specifically around healthcare, right? And we know that the county does work specifically around Black infant care, for instance, and so we want to make sure we're elevating our African American and Black community to make sure that when the work is being done and when healthcare is being provided, that people understand why it's so important to understand, the biases and in healthcare and in the system and how it impacts different communities. And so I was really proud that we approved these resolutions, and it was done unanimously by the Board of Supervisors. I think these actions will allow our county government to prioritize equity and make sure that any future investments that are made in communities where the need is greatest based on science and data. So I'm excited about that. Me orgullece mucho que ambas resoluciones fueron aprobadas por la Junta de Supervisores. Eso permite pues que en realidad nuestro condado le dé prioridad a la equidad y asegura de que cualquier cantidad de fondos que vengan del gobierno federal en el futuro se inviertan en las comunidades que más lo necesitan basado en la ciencia y en los datos. As of now, I just see a lot of hellos. I don't see any specific, questions. So I'm going to keep sharing information. And if you have questions, just go ahead and type them up. Joanna from my team is helping me. And so if anything comes up, she'll let me know so that I can respond to your questions, right? So other things to note that are really, I think, really important in the last week, and I'm so used to having conversations with someone, so it's kind of weird to just be directing information at you, but there's a lot of really great things to share. Last week, the vaccine superstation at Petco Park began operating. This was made possible through the partnership between the County of San Diego, the City of San Diego, and UCSD Health and the San Diego Padres. I actually had a chance to tour the vaccine superstation with a couple of other colleagues, and I just saw all the great efforts our frontline workers are doing to get the vaccines into the arms of healthcare workers much faster. And I have to say that I was so impressed by the way they were doing the work, and it was just so thorough. And I mean, things are moving very fast, and the way they were providing the service in the healthcare was great. And they're making sure that people get to go and stay, and those are in the first tier, because I think it's important to share. Anybody who's in the first tier are the folks who are getting the vaccines. And so it's really important that people know that that it was just a really thorough process. And so a principio de semana pasada comenzó a operar la primera superestación de vacunaciones en Petco Park. Esto fue posible gracias a una colaboración entre el Condado de San Diego y la Ciudad de San Diego, UCSD Health y los Padres de San Diego también. Yo tuve la oportunidad de recorrer la superestación hace unos par de días con varios de mis colegas, y realmente pues vi el gran esfuerzo que no solamente están realizando para acelerar el proceso de vacunas a los trabajadores de salud, porque son los que están todavía en la primera fase. Y ahorita vamos a hablar un poco de la confusión de lo que significa las diferentes fases, ¿verdad? Pero esa semana también, pues me dio mucho gusto verlo, porque pues en realidad el proceso es un proceso que lo tienen sumamente organizado, y pues para que no se vaya, lo más importante es de que las vacunas que estén abiertas, que se les den a las personas, así que está funcionando muy, muy bien. The other thing that was, I think, really exciting is that we also this week had great news for District 1. I think all of you know the boundaries of District 1, and I'm going to be focusing a little bit on that, but we're all the way in Paloma, Coronado, Imperial Beach, Chula Vista, National City, and all of the southeast, Paradise Hills, Lincoln. So it's really a huge territory, and the need is really great. And so I just want to make sure that I'm excited to share that the 3 vaccine pods have already been opened up in the last 2 weeks. We were able to open Coronado, and Imperial Beach. Chula Vista was already up and running. And so it was exciting to go see it as well. That makes 3 vaccine pods in District 1. And these vaccine pods are only providing vaccines to people eligible under phase 1. And that includes healthcare workers and those in long-term nursing facilities. And so if you look at a previous post that I did, it has specific information, but I'm going to have Devana put it up again so that we can make sure that all of you see it. And it's, I had retweeted, I had put it up or something, but this is really important. And I know that there's a lot of frustration, and there's, people are concerned about who can get in and not who can't, but we're working really hard for additional locations and partnerships to bring the vaccine superstations to the South Bay so that we can help move through phase 1 quicker and get treatment to our communities as soon as possible. Trust me, I wake up every day fighting this, and working really closely with the County of San Diego, who, actually they've been doing a wonderful job and trying to make sure that we're getting out there. I know it may not seem like it to everyone, because not everyone's getting their vaccines who wants to get them, right? Like the 65 and older. But I think what's important to note is that there is a process, and the process exists so that the folks who are in these tiers are getting their needs. And so, como les comentaba, pues muy importante para nuestro distrito es que tuvimos buenas noticias y tuvimos la apertura son 3 diferentes sitios de vacunación. Uno fue en la ciudad de Imperial Beach, que fue el viernes. Con este sitio ya son 3 sitios en donde están los otros son en Chula Vista y en Coronado. Y como saben, mi distrito es sumamente grande, nuestro distrito, el distrito 1, Point Loma, Imperial Beach, Coronado, es sumamente extenso. Entonces estamos tratando de hacer lo posible para que podamos tener los sitios de vacunación. En este momento, esos sitios de vacunación solo están vacunando a aquellas personas que son elegibles bajo la fase 1. Esto incluye a los trabajadores de salud y a los que se encuentran en las clínicas de cuidado a largo plazo. Pero también estamos trabajando para buscar lugares y colaboradores para traer una superestación de vacunas como lo del Pepco Park aquí en el South Bay. Y creo que esta semana vamos a poder anunciar algo, yo creo que para finales de semana, para empezar. Lo que ocupamos es que toda la gente que está en fase 1, lo más rápido es hacer llegar esas vacunas a nuestras comunidades lo más pronto posible y para que la gente pueda tener acceso, ¿verdad? La otra cosa es que sí quiero agradecerle al condado porque el trabajo que están haciendo, lo están haciendo con poca información. O sea, todo está pasando muy rápido y sin embargo lo están haciendo muy bien. Y pues yo estoy muy agradecida porque seguimos pidiéndoles o abogando por la comunidad y están haciendo el trabajo y eso creo que es importante. A ver, hay diferentes personas que tienen preguntas. Las voy a leer primero y luego las contesto. La primera es de Coyote Moon. Hi, Coyote. Thank you, Moon, for being on here. You said you've been waitlisted over a week and you need some help, and so we can take a look at it to figure out where you fit into the phases and see where we're at. I will follow up with one of my team members can follow up with you and make sure that we can help you out and find out where you're at on there. And it says, congrats again on your new position. Are there any plans to have vaccination centers in zip codes 92173, 92154? Absolutely, absolutely. San Isidro and like the south area of San Diego, Ocean View Hills, all those areas, we're working hard to try to find something. For me, it's really important that we look at transportation, that we look at, access, and that's where like the equity lens really comes in through. And I'm really proud that we have a really strong team that's working with Nick Machoni and his staff and Barbara Jimenez and all these folks who have, they know the district, they know the area, and they have been working really closely with us to make sure that we are going to have these locations. So let me just say it in Spanish so I don't forget. For Moon, we're going to follow up with her to make sure that we have, con Moon vamos a trabajar con ella para ver si ella en qué parte del nivel está para darle la información. Y mi equipo se va a encargar, ¿verdad? Y luego nuestro school member Beto nos pregunta sobre que si hay planes de las vacunas en los centros de los códigos 92173 y 92154. Y la respuesta es que sí. Estamos muy contentos del trabajo que estamos haciendo con Bárbara Jiménez, con Nick Machoni del condado de San Diego. Ellos están comprometidos y entienden que para mí es muy importante que existan los centros de vacunas y no solamente los centros de vacunas, pero que los proveedores hablen el idioma, que puedan comunicarse con nuestras comunidades y que la información esté exactamente pues accesible a todos, ¿no? So it's my commitment that we do that. And then Hugo says, where can we get more information regarding appointments for seniors 65 and up? And when do you estimate roughly to get the process started in the South Bay? Okay, so the process already has started in the South Bay. We have vaccines already, but you have to go through an appointment. I'm going to have Devana put up the website so that you all have it, and you can go to the website and it'll tell you, when you for you to make an appointment. Now, the other thing that everyone should know, and I didn't want to forget, is that there will be a portal that's coming soon, and it's a portal that's being created by the by the state of California, and we're waiting for it. And the reason why we decided to wait was, and my understanding is we're going to be part of the pilot program, is because the more we do this, the better it's going to be for us to be able to get the information out to our communities and so on and so forth. So yes, we're going to make sure that people have access to the portal, and then. The other thing was that I want to make sure I emphasize that this is completely confidential, right? I think a lot of folks in our communities are really worried about, like, once I put my information in my database, are they going to ask me for my documentation? Are they going to ask me for any of that stuff? And you have to remember that the county is here to serve all of our community members, and it doesn't matter what your status is. We're gonna make sure that everybody has access. And I think two things to note that are really important. If you have healthcare insurance, it's really important that you go through, if you have Kaiser, Sharp, whatever your health insurance is or whoever your provider is, go directly to them and ask them when is this going to happen? And they should have information for you already there. We're going to try to link all of that to my website, and we'll put it on my social media as well so that all of you have it. But it's really, really important because what we want to do is, if you have health insurance, have your provider be able to give you the vaccine. And then let's make sure that all of the county vaccines go to so many of the folks in our communities who all of us know may or may not have access to healthcare insurance or, so folks are medical, et cetera. So, a ver, rápido, para que no se me olvide todo lo que dije. Me preguntaban que si había información para las personas de tercera edad de 65 para arriba y que cuándo creemos que van a poder tener las personas acceso a las vacunas en el sur de San Diego. Pues lo que estamos haciendo ahorita es, se han abierto un poco más de centros de salud, centros de vacuna. Ya llevamos, como le comentaba, 3. Entonces ahora es sumamente importante que la fase 1 pase rápido, porque entre más terminemos la primera fase o lleguemos lo más cerca que podamos a la primera fase, nos podemos seguir a la segunda fase, es donde vienen las personas de 65 en adelante. En otros condados lo están haciendo, pero lo están haciendo los proveedores. Entonces ahí es donde está la confusión, porque el gobernador dio el ok para los proveedores de salud. O sea, que si tienen seguro médico, ellos pueden darlo porque tienen sus vacunas para poder dar, pero no todos los proveedores lo están haciendo porque todavía tienen que terminar con la primera fase. Entonces, por eso hay confusión, porque el directivo que dio el gobernador era un directivo para todo el estado, no nomás para el condado para el condado de San Diego, y cada condado es diferente. Entonces, ese es el impacto que está teniendo, ¿no? Así que, definitivamente, a ver, me pregunta Ginger Hicks que sobre las vacunas y que son seguras. Sí, las vacunas son seguras. Todos sabemos que sí fue un proceso más acelerado, pero esperamos que la gente sepa que lo hicieron más rápido porque estaban trabajando directamente en eso y en nada más, ¿no? Entonces, sí son seguras. No ha habido en realidad casos en donde se han impactado a las personas. Entonces, queremos que la gente, por favor, vaya y tome sus vacunas. And so Ginger was asking about the vaccine and is it safe? And is it safe to get it? And, I'm not a doctor, but I can tell you that based on the information that I've received from our public health department, and maybe we can have somebody from our public health department come on one of these weeks, maybe in 2 weeks or so, one of the medical doctors, and they can share with you, or one of the nurses, that it is safe. And we haven't had any major challenges. It's important to know that yes, it was done faster than most vaccines, but the reason for that was because people were doing nothing but trying to find a vaccine to help everyone get back, to their daily routines. And so, yes, Moderna and Pfizer have both been, provided to, hundreds of thousands of people already, and people are doing okay. I mean, some people who have reactions are that's normal for people who have reactions to some things. But for the most part, what we know so far, that the science behind it is that it is safe, and it is one of the ways that we're going to see the light to get out of, the COVID pandemic the way we are. And so the question is there any information regarding mobile vaccine distribution, perhaps to hard-reach areas, senior citizens, mobile homes, homeless community members? Oh my God, these are great questions. Okay, so let me tell you, I had an opportunity to tour the facility that is in North Island, se me olvida, por Liberty Station. I went about, the first, actually before I became, like 1 week after I had just been became elected to this role. And there is an opportunity for us to, so what happened was I ended up going and did a tour. And this is the firefighters and the County of San Diego are working together to train a lot of other folks. So we have our nurses being trained. We have EMT, the paramedics that are being trained that are used to giving vaccines. There's a lot of innovative ways of looking at how do we get enough people trained to be able to give the vaccines, and because it's a really cool process, right? It's not just like a flu vaccine. They actually have, you have a vial, and then that vial has about 5 vaccines from it. And so they have to like measure it and they have to time it, and it has to be in like a cold refrigerator. And when they take it out, they have to make sure that they have the 5 people that they can give it to. And then you wait 15 minutes or 30 minutes, depending on your healthcare and where you're at. And then once you're okay, then you get to go home. And so it's not like the flu, when you get the flu, you just go, they give you a flu and then you can leave, you walk away. This one's a little bit different, but it's super easy and it's safe and it's really good. And so all that to say that I think the county and our firefighters and our folks understand that the best people to provide these vaccines are the people who know their communities. And so we do have absolutely this concept of the mobile vaccines distribution happening, and it's happening in one of our southern cities. I am not at liberty to share it just yet, but I will make sure that we announce it this week on my Facebook and my social media, so you can all know about it. It's just that they're still like figuring out a couple of different things, and yes, they're absolutely going to go to hard reach areas, senior homes. And so that our homeless population, many of them have, some of them, I think we have a partnership. They did a partnership with Father Joe's, and they were able to vaccinate many of the folks in the community as well. So, la traducción para todo eso es de que las vacunas móviles sí van a existir. Aquí en el condado de San Diego, en el sur de San Diego, vamos a tener, esta semana creo que vamos a anunciar una de ellas. Todavía no te puedo dar todos los detalles de eso porque estamos todavía participando con la organización, con la ciudad que va a tener este proyecto móvil, pero en las redes sociales lo vamos a poner antes de que se acabe el fin de semana para que ustedes tengan la información. Y para las personas que no tienen hogar, hemos estado trabajando y el condado trabajó directamente con Father Joe y otras personas en esa comunidad específicamente para poder darles a las personas que no tienen acceso a comida, ¿no? Let's see. Yes, and we need governments to do strong PSAs on social media, TV, radio, and podcasts in all languages, especially Spanish and English, so that people are not confused and are educated that they must get the vaccine, because even if they survive COVID, their lungs will be damaged for life. Sí, no solamente los gobernantes, pero las personas que les tienen confianza, ¿no? Para que hayan oportunidades de poder tener información en todos los lenguajes y los idiomas, para que las personas entiendan que esto es muy importante, la vacuna, y que pues queremos que la gente no solamente no le dé, pero que también la gente tenga acceso a la vacuna. Entonces, te podrían crear un documento, folleto para escribiendo esta información. Absolutamente, sí, Hugo, we will be creating, we are actually in our office, we're trying to think about what we can do. What we'll do is I'll ask Devana to put up some of the information up here so we can have it. And then what we'll do is we will also make sure that we are sharing the information as well. And so vamos a encargarnos de buscar los folletos y que esa información esté aquí para que la puedan tener. ¿Qué más? Estamos buscando otras maneras, ¿no? Lo que sí quiero reconocer es que la organización, específicamente en la comunidad latina, la organización de Latino Health Coalition ha hecho mucho trabajo. y están haciendo mucho trabajo específicamente con medios de comunicación para llevar la información a las comunidades, y también van a tener creo que es una campaña en donde van a decir yo me vacuné, y la gente pone su foto y platica qué les pasó cuando se vacunaron, para que la gente esté más contenta y sepan que es importante vacunarse. And so I just want to give a shout out to Latino Health Coalition, because they are actually doing vaccines. I mean, they're doing media in language, and I know the county also has been really closely working with faith leaders, the African American community, and other I think the other communities, specifically to make sure that folks have information that is relevant and important to their communities. The other thing, let's see, Mr. John Brady says, are there any plans to declare homelessness and housing a public health care crisis? Homelessness and housing are two issues that are absolutely critical, and I actually think they go beyond being a public health care crisis. They are a humanitarian crisis, and something that I am absolutely committed to working on. In my role as a supervisor, I will be serving on the Regional Task Force on Homelessness, and will be absolutely working with all of you to make sure that we begin to address some of these issues. I should share with you a couple of things that I don't want to forget before our time is up. And I know, thank you, Norma, for asking about how my constituents can best help efforts, and I'll share some of that with you as well. Let's see. So let me just translate all this stuff so I don't forget. So Mr. Brady me preguntaba sobre las personas que no tienen casa, o que no tienen, las personas que no tienen vivienda, y las personas que no tienen vivienda, que están viviendo en las calles, ¿verdad? Súper importante. Ese es un tema que no solamente es una crisis de salud pública, es una crisis humanitaria, que creo yo que nosotros tenemos el compromiso de trabajar y de abogar por esas comunidades, ¿verdad? Entonces, esto para mí es una prioridad. Tengo el honor de que voy a ser, ahora por lo que estoy trabajando yo, tengo la oportunidad de ser la presidenta. Participo en el Regional Homeless Task Force, que es una organización, un comité que habla de esto específicamente. Entonces, es importante que sepan que es prioridad para mí, y lo voy a seguir trabajando. Norma me pregunta que si, Norma Cázares, ¿cómo estás, Norma? Me pregunta que si cómo pueden trabajar las personas que viven en mi distrito, cómo pueden ayudarnos. Entonces, primeramente creo que vamos a tener diferentes maneras de informarlos y de darles información para que tengan lo que necesitan, para que ustedes son las personas que otras personas conocen, ¿verdad? Entonces, cuando ustedes van y le dicen a la gente, mira, yo me tomé mi vacuna, yo hice mi vacuna, quiero que la gente sepa, eso es importante para que todos ustedes lo puedan, ¿cómo se dice? Diseminar por todas las comunidades, etcétera, etcétera. Entonces, vamos a incluirlos en el proceso. Yo me comprometí con ustedes cuando decidí ser candidata que íbamos a hacerlo de esa manera, donde la comunidad iba a ser parte, y eso es absolutamente importante para mí, y vamos a estar dando toda la información a la comunidad lo más pronto que la tengamos, se las damos. Entonces, Norma was asking how my constituents could better support the efforts in our district, and I think by engaging, it's super important. I will share with all of you, I think Devana posted this already, but it's District 1 Community at SanDiegoCounty.ca.gov. That's our email, so that we can make sure we get information from you. Questions, concerns, accolades, whatever you want to send us, please send them our way. We want to make sure that we are available to all of you. Like I said before, I have a team of social justice warriors that are doing great work on the ground. We have hit the ground running this is our third week, and I feel like we've been doing our best to elevate some of the issues that I heard from many, many of you throughout the campaign trail. And so my commitment to you is that we're going to do the best that we can to get things out. if something is not working, reach out to me. I mean, I think everybody has my cell phone, but reach out to the email. I'm trying to make sure, I think everybody saw the other day that I have about 300 text messages that I haven't responded to, but I'm working on it. I'm trying to get to it. I just haven't had a chance. And so thank you. The other question is, hay fondos para hoteles disponibles para personas que tienen COVID y quieren estar aislados durante su periodo de incubación y recuperación. No me preguntaron esa pregunta antes, pero sí existen fondos. Lo que vamos a hacer es, le voy a pedir a Devana que pongamos la información en donde, o mándeme un email y podemos poner esa información en mis redes sociales y también lo vamos a poner en las redes de mi distrito también en cuando tengamos ya toda esa información. Lo que pueden hacer también es hablar al 211, pero si por alguna razón no le contestan, usted no deje de hablar o de mandar un correo a mi distrito, al email del distrito, y nosotros nos encargamos de ayudarles. So, Hugo was asking if there are funds for hotels for folks who have COVID and they want to be, they need to be isolated for a period during their incubation and, when they're recuperating. And I said, that we do, the county does have funds for that, exactly. And folks I was reminded, folks can call 211 or email me at the district email, and then we can get you the information. And I'm gonna try to get that information and put it on on our website as well, so that you have it. And there's a lot to say, a lot of great work happening. We're going to try to figure out a way to do this more interactive so that all of you are able to ask questions. We're going to start having Conexiones every week at 11:30, and I'll be coming to you either from the county or from my house, depending on where we're at, just to make sure that you have the information. If you have questions or things that you want to hear from me on, feel free to reach out. When I ran for office, I said I would do this. I want to make sure that we're really transparent and we're open and we're sharing the information. And so we'll get that for you. The other thing I forgot to mention to everyone is that, I get, as the vice chair of the board, which is, pretty historical. I also get to be the co-chair of the COVID subcommittee. And so I get to work with Chair Fletcher very closely, and the county team, to make sure that we are prioritizing the needs of those hard-hit communities, and so and communities of concern. And so what I sort of continue to focus on is that we have, and we as a county do, is the equitable distribution of the vaccines, bringing more vaccine pods into the South Bay, opening a super station in the South Bay, and keeping our communities informed of when it's their turn for the vaccine. So we're going to continue to do this, and we're going to do it right. Okay, we're going to do everything we can. And I know there's a lot of questions, so we're going to try to get every question that people have. And then, nomás para traducir esta información, es que como presidenta de la Junta de Supervisores, que es algo histórico, ¿verdad? Y estoy muy orgullosa de tener esa oportunidad. Soy también copresidente del subcomité de COVID. Mis prioridades para estas próximas semanas, estos días, y las cosas están moviéndose súper rápido, ¿verdad? Pero la distribución equitativa de vacunas es sumamente importante para mí. Traer más sitios de vacunación al sur de San Diego. Abrir una superestación de vacunas en el South Bay también es importante. Y lo vamos a hacer, y mantener a nuestras comunidades informadas sobre cuándo es su turno para recibir la vacuna. Entonces, esos son los trabajos que, bueno, a lo que me comprometo esta semana, ¿verdad? Junto con todo lo demás que estamos haciendo, para que tengan información. La verdad, Silvia, no, tengo dos preguntas antes de que me vaya, porque me hicieron estas preguntas. Do you know when they will be ready for adults 65 or older? And, hola, Selene. Si no tienes plan de salud médico, se puede poner la vacuna. Sí. Entonces, okay, so I'm going to answer both of these questions to the best of my ability. So the first one, 65 and older, we have to get through the first phase first before we can get to 65 and older as a county. And so we're working on that. Let me get back to you on what the actual projection is. I think I know, but I don't want to say something that may be wrong. So I will check in with my county colleagues, and I'll get back to you on that one, on where we are projecting. I think what the problem is we have to make sure we get all of the healthcare providers first, and everybody who actually fits into the phase 1, and then we'll get to the 65. So I think they're in the middle. So I will get you that information. No estoy segura exactamente cuándo, o sea, cuándo son los días, ¿no? Para llegar a los 65 más, pero eso tiene mucho que ver porque no sé exactamente, tengo que ver en qué parte están ahorita del nivel de personas que están en la primera fase y en dónde entran los 65 para poder darlos. Así que esa pregunta se las voy a regresar con esa respuesta en cuanto la tenga y que tenga una mejor idea porque apenas como estamos ya abriendo muchos centros de salud, eso nos está dando la oportunidad de que a lo mejor se va a poder acelerar el proceso más rápido, ¿no? Entonces, eso es súper importante. So, one thing that I failed to mention in English was the reason why we're opening up all these super pods is because the super pods are allowing us to provide the vaccine sooner. And so the more vaccines that we're able to get out to the phase 1 folks, the faster we can get to the 65 and older folks under the county. So I just want to make sure I share that, but I will try to get you closer to when it's going to happen as soon as I can. I know, I don't like to just make up things because then, I don't know. I mean, there's assumptions that I can make, but let me just get back and get back to you because there's 500,000 people that have to be vaccinated in phase 1. And so that's the piece that I think the magic number that we're looking at. Son más de 500,000 personas las que se tienen que vacunar en la fase 1, así que eso es lo más importante ahorita, que tenemos que tener estas superestaciones para poder vacunar a toda la gente posible, ¿no? Y la pregunta es de que si no tienes plan de salud, no, eso es lo importante del condado de San Diego, ¿verdad? Que es proveer salud pública a todas las personas que viven aquí en el distrito, no importa su estatus legal, etcétera, etcétera. Entonces, esas personas van a poder tener acceso a la vacuna en cuanto le toque, basado en las diferentes fases. And so the question is, if you don't have healthcare, will you be able to get the vaccine? And so it's the same answer related to sort of how the same way we do, COVID testing, right? The vaccine is free. The vaccine is, or at no cost, I should say, because we do pay for it, right? The county pays for it. So it's no cost to the patient. We make sure that your information is confidential, and there is no requirement for any type of you don't have to pay for it or anything like that. So it's really important that people know that. And so if you have a healthcare provider, we're encouraging you to go to your healthcare provider. But if you don't, you can go to one of the county sites. And that's why the vaccine process has been so important, because the testing, because all of the testing sites are in neighborhoods and in communities. And so that has allowed for systems and operations to be created that will allow for this to really help people as we move forward. So I hope that's helpful. I know it's 12:24, so I've kind of gone over the 30-minute span that we usually try to do. If you have any questions, feel free to post them on here, or go to District 1 Community at sandiegocounty.ca.gov, and we will get your questions answered. My team and I are ready to help and do what we can to connect you to the right person at the county and to get you the answers that we need, and also be able to get you information, and we're working on various languages as well. And thank you, Stephanie, for the comment, of being able to deliver my starting in speech in English and Spanish and the live updates. I really am trying to do my best. I wish I knew Tagalog, and I wish I knew other languages as well, but I only know 2.5 languages. So English and Spanish and a little bit of French, but I will do my best to get the information to our constituents, to my community, because this is why I ran, and this is why it matters to me to have what all of you need. And I do want to say thank you to everyone for reaching out about my dad. He's actually doing okay. And that's why, the story was really emotional, but my dad's doing fine, and I'm really grateful to all the healthcare workers at Sharp for helping him through this really horrible pandemic, and they're just so amazing. And so, muchas gracias, Stephanie, por agradecerme, pero en realidad, pues, lástima que otros idiomas, me gustaría saber tagalo, porque hay una gran cantidad de filipinos en mi distrito, pero no me la sé el idioma. A ver, a lo mejor puedo aprender unas cuantas palabras, pero yo estoy muy orgullosa de ser bilingüe, de hablar inglés, español y un poquito de francés de vez en cuando, ¿verdad? Pero muchísimas gracias, y todo lo que yo pueda hacer por trabajar por la comunidad, con mucho gusto lo voy a hacer. Yo, cuando me postulé para candidata, lo hice con esa idea de que la gente tenga acceso y que el gobierno, pues, en realidad ayude a nuestras comunidades. Así que estoy muy orgullosa de poder tener esa oportunidad. Y quiero darle las gracias a todas las personas que me mandaron notitas, text messages, todo para preguntarme sobre mi papá. Ya está bien, y quiero dar las gracias a las enfermeras y a los doctores y a toda la gente que le ayudó. Él está en Sharp Hospital, estuvo en Sharp Hospital, y estoy muy agradecida con ellos por todo lo que hicieron, y por todo lo que hacen por todas nuestras comunidades. Así que muchísimas gracias. No se les olvide usar su cubreboca. No se junten con sus familias. Yo sé que los extrañan. Yo también los extraño. Todo el mundo extraño a mis amigos, extraño andar de fiesta, extraño todo eso, pero pues, entre más sigamos haciendo todo lo posible, ya vemos la luz, ¿verdad? De esperanza con la vacuna, para que todo esté mejor y podamos regresar a nuestras rutinas. And so, thank you everyone for your time. I just want to say again, don't forget to wear your mask, stay 6 feet apart. We're going to do everything we can. Know that I am working hard on trying to figure out how we're going to make sure we're connecting around economic recovery as well. And so I just want to say thank you. I'm looking forward to continue these conversations, and I hope you have a wonderful, blessed day. Muchísimas gracias y que tengan un bonito día.